Hi, my name is Dr. Sierra Bazell, and I'm a certified health coach and an IBCLC. And today I want to talk to you about why having a short luteal phase can cause a problem when you're trying to conceive. If a person has a short luteal phase, that means that the time from ovulation to the time in which they would conceive or find out that they conceived and or the time in which they would actually need to be having their cycle if they have not conceived is short. Typically, that time should be somewhere between 10 days and 17 days. And if it is any less than 10 days, then it is too short because that does not give the body adequate time in order for the growing baby to be able to develop, nor does it give the endometrial lining the time that it needs in order to be thick enough for the baby to be able to implant there. So if a person were to be having recurrent losses, we would look at their progesterone levels, and we would look at their luteal phase by looking at their chart to see if this person is having a short luteal phase. If they are, then they could be very well ovulating just fine, but it could be that their progesterone levels are low. And if their progesterone levels are low, they will not be able to sustain the pregnancy. So would it be a good idea to get pregnant with low progesterone? Probably not, because we can see early losses such as chemical pregnancies or those people that tend to have recurrent losses around week 6 to 8. If this is happening within a person's body, typically you would see signs like spotting or that person is having some type of PMS symptoms, so like really sore breast or chest. They may have headaches. They may have cramping prior to their cycle. They may notice that they feel like they have flu-like symptoms prior to having their cycle. They would possibly even have mood swings. So if this person is having PCOS type of symptoms, this can be seen in them. It can also be seen in people that have endometriosis and possibly someone that has fibroids as well. Typically, these people will also tend to be more estrogen dominant because their progesterone levels are low, so their estrogen levels are typically a little bit higher. And if that is the case, there are things that that person can do. What can be done? Well, they can check to see if their progesterone levels are low. They can also check their vitamin B levels because vitamin B helps with hormones and it helps to help with ovulation, which allows that person's progesterone levels to be able to increase. They can also make sure that they're not having an issue with PCOS, endometriosis, fibroids, or having a under or active thyroid issue. They can also look at what's going on in their chart. So are we seeing dips that are happening too quickly? Are we seeing that this person is having a slight rise in temperature right when they're supposed to be ovulating? And then are we seeing that that person has a very large crash or dip right before their cycle comes on? So you would see these patterns in that person as well. And we could typically see someone have spotting during their normal cycle when they're not supposed to be having their period. So the menstrual cycle for that person, let's say it's a 28-day cycle, and they're noticing that on day 14, they're having spotting and it's brown spotting, or that they are starting to spot on day 24, but their cycle actually starts on day 27. So we could see something like that happening in that person as well. If that were to happen, what we could do is if their vitamin B levels are low, we can look at possibly taking a B vitamin complex supplement, because again, that can help with ovulation. It can help to increase that luteinizing hormone, which will then allow them to make the amount of progesterone that they need to make. We could look at possibly taking Vitex, which can help to balance out those hormones, reduce some of that estrogen, and increase the progesterone. We could look at eating antioxidant-rich foods, so lots of berries. We can also look at acai, because that can be helpful as well if you're a person that doesn't typically or necessarily like fruit. That person could also look into acupuncture or acupressure, because that can help as well. And we want to make sure that the person is not over exercising, because over exercising can cause problems for people as well. When you are under stress, your body has to decide if it wants to outrun a bear or it wants to allow you to conceive. So if you are exercising heavily, you're doing 2-a-days in the gym and you're staying in there for 2 hours, you're lifting weights, you're running, you're doing CrossFit, you're doing all these things at one time, that could tell your body that you are stressed because you are under attack and you need to be in fight or flight mode. And if that is happening, then that person may not be able to conceive, because their body is choosing between staying alive and giving them a baby. So in that event, we would want to cut back on some of the exercise that is being done, maybe look at things that are more gentle, like yoga, walking, Pilates, even looking into maybe cutting back on the amount of time that that person is running. And maybe they do cardio once a week, and they can cut down on the amount of weight that they're using. So we want to make sure that the body gets into balance. That could mean also reducing stress. So if you are working crazy hours at work, maybe you want to look at taking more time on your days off to get more rest, or cutting down on some of the things that you're doing outside of work, and just making sure that you're creating an environment in which your body is ready to have a baby. Because if we try to conceive, even though progesterone levels are low and you're stressed, this can lead to those early miscarriages, and doctors can try to give people progesterone, but sometimes if it is too low and we just start throwing progesterone at the body, it's not going to do what we want it to do, because it can take time for the body to actually start to recognize that it's taking in progesterone and that it needs to sustain the pregnancy. So with that being said, you want to make sure that your body is ready for a pregnancy before you go and try to get pregnant. If you have any questions or comments, please feel free to reach out to me and we can discuss this further. If you want to have me talk more about what can be done to help you be able to conceive, please be sure to leave a comment or to send me an email. Have a wonderful day or night whenever you're watching this.